Aerosols on uterine artery function in rats. Welcome.
The prevalence of nicotine usage in the United States, primarily via traditional tobacco smoking, was on an upward trajectory until the 1964 Surgeon General's report on smoking and health. Since then, widespread public health campaigns, federal legislation, advertising bans, and increased taxation have led to a steady decline in nicotine usage. An abrupt change in this trajectory occurred when commercially available e-cigarettes entered the market in 2007. Exploiting loopholes in the Public Health Cigarette Smoking Act, aka the broadcast ban, manufacturers marketed their products as cheaper, more flavorful, less harmful, and useful as smoking cessation aids. The burden of disease fell on our youth. Between 2011 and 2018, there was a progressive decline in the percentage of high school students using traditional cigarettes. However, this was accompanied by a reverse trend of increasing e-cigarette usage. An estimated 20% of high school students used e-cigarettes in 2018, which prompted the Surgeon General to declare e-cigarette usage amongst youth as an epidemic. There exist major knowledge gaps regarding adverse perinatal outcomes of e-cigarette usage during pregnancy. One of the largest data sets comes from the Phase 8 survey of the Pregnancy Risk Assessment Monitoring System, PRAMS, between 2016 and 2018, which included data from over 55,000 pregnant persons. Analyzing the PRAM data found that traditional and e-cigarette exposure during pregnancy have an increased odds ratio for 3 of the same adverse outcomes, being small for gestational age, birth weight under 2,500 grams, and spontaneous preterm birth prior to 37 weeks, when compared to non-smokers. Interestingly though, there was no statistically significant difference between these 3 outcomes from e-cigarettes and traditional cigarettes. A study performed in 2015 in Oklahoma and Texas found that 7% of pregnant persons reported e-cigarette usage shortly before, during, or after pregnancy. Examining factors associated with e-cigarette usage, a 2017 survey found that 75% of those who used e-cigarettes during pregnancy had switched from traditional cigarettes when they learned they were pregnant. Animal research has found that fetuses exposed to e-cigarette vaping in utero have altered DNA methylation, altered transcriptomes, increased inflammatory markers, altered metabolic pathways, as well as structural and functional pulmonary and cardiovascular differences. E-cigarettes come in varying sizes and shapes, but their basic engineering is the same. There is a nicotine delivery liquid with a heating coil, an air intake, a vaporizing chamber, and an aerosol outlet. The nicotine delivery liquid, colloquially, is called vaping juice and consists of differing ratios of propylene glycol and vegetable glycerin, plus nicotine and then natural flavoring or natural artificial flavoring if desired. Users can actually modify the PG-VG ratio based on their own preferences. Up until 2016, the flavorings were not FDA regulated and varied vastly in their ingredients. The passive fully dilated diameter of the uterine artery is approximately doubled. This enlargement occurs due to hypertrophy of the outer wall in comparison to the eutrophic hypertrophy of hypertension or the inward hypertrophy of atherosclerosis. Similar changes are found in rodents, making them ideal research models. Here you can clearly see that the human uterus is different from the rat uteri. The rat uteri have 2 horns. This is one horn of a rat uterus, showing 9 feti with their respective placentas below. The long, thin below it is the uterine artery with the radial arteries and then the branching arcuate and then branching radial arteries. Pregnancy associated Pregnancy is associated with increased uterine artery expression and activity of prostacyclin, nitric oxide, and endothelium-derived hyperpolarizing factor. The endothelial nitric oxide synthase is preferentially expressed in the uterine artery during pregnancy. On the right, you can see the uterine artery eNOS protein expression compared to an omental artery as a control. So we hypothesized that e-cig vaping during pregnancy would result in an endothelium-dependent uterine artery dysfunction mediated by the nitric oxide system. A custom-engineered vaping system with precision-controlled aerosol release technology was used to replicate the latest generation of e-cigarette atomizers currently on the market. Pregnant rats were exposed to e-cigarette aerosols using airtight chambers with unidirectional flow 3 hours a day, 5 days per week. The rats were sacrificed on gestational day 20 in the first cohort and 21 in the second. Term pregnancy in rats is 21 to 23 days. The uterine arteries were harvested, cleaned, and mounted onto a pressure myograph using sutures. The pressure myograph maintained physiologic conditions with a pressure of 90 millimeters of mercury. Uterine artery lumen and outer diameter were measured with an optical camera. Here you can see a maximally vasoconstricted uterine artery, but note how wide the gates were prior to constriction with thromboxane. After maximum vasoconstriction, a serial 3-fold increase in concentrations of acetylcholine were dosed to sequentially vasodilate the vessels. Once at maximum dilation, the eNOS pathway was blocked with L-name, which is a nitric oxide synthase inhibitor. And the difference from maximum dilation to the drop was measured and demonstrated the nitric oxide component of this vasodilation. 3 ingredients went into the vaping chamber. Mass spectrometry identified numerous byproducts after aerosolization. The e-cigarette nicotine concentration in rats was found to peak at between 3 and 6 hours of vaping and matched that of the nicotine concentration found in humans that are moderate to heavy smokers. So this was the rationale behind vaping the rats for 3 hours a day. Maternal weight was not altered throughout the pregnancy, and the nicotine animals were pair-fed so that they received identical nutrition as the controls. The first group of rats were sacrificed on gestational day 20 and had a statistically significant progressive decrease in fetal weight and crown rump length from the control to the base to the base plus nicotine. A second group of rats were allowed to spontaneously deliver, and these neonates were followed up until postnatal day 10. The pair-fed juice and controls had similar postnatal growth trajectories. However, the slope, as you see there, for the juice plus nicotine was diminished. I mentioned before that rat gestation is 21 to 23 days, so 1 day of rat gestation is equivalent to almost 2 weeks of human pregnancy. For this reason, to increase the length of exposure, we then had a separate subset that we sacrificed on gestational day 21. Again, we had the same findings with the decreased fetal weight and the decreased fetal crown rump length. This time had a very statistically significant decrease in the placental weights between the control and the e-cig groups. Physiological effects, the maternal and the fetal heart rate on gestational day 20 were not statistically different. Ultrasound Doppler interrogation of the maternal uterine and the fetal umbilical arteries were performed, and cross-sectional diameters were measured to estimate the flow in milliliters per second. As you note in these graphics here, there was the same decreasing progression from the pair-fed control to the juice plus nicotine in the estimated flow per milliliter per second. Here are 2 of the pressure myograph readings, the outputs. The top is the control and the bottom is the nicotine plus the juice. As a group, the mean and standard error of the mean are shown here, and we're statistically different comparing the basal diameter and the acetylcholine stimulated response, which you can see are significantly lower in the e-cig group compared to the controls. The magnitude difference between the control and the L-name maximum % dilation demonstrates the nitric oxide component of the e-cigarette-induced functional deficit. Again, note the lower maximal dilation of the e-cig group prior to L-name administration, again demonstrating a baseline functional deficit in this group. Phosphoserine 1177 eNOS is the most prominent excitatory phosphorylation site, and it was significantly decreased in the e-cig group compared to the controls. As you can see on the right panel, this was accompanied by a concomitant decrease in the total eNOS expression, which is the rate-limiting enzyme for the endothelial-derived dilator nitric oxide. Interesting, again, note the decrease in the Juusela group between the phospho and the total eNOS, and they sort of switched in the pattern. So this was the first study to demonstrate in vivo that e-cig aerosol exposure during pregnancy disrupts the endothelial nitric oxide mediated vasodilation of the uterine artery, and there are three fundamental outcomes that can be garnered from the study. The first is that during pregnancy, e-cigarette aerosol exposure significantly attenuates the agonist-induced vascular reactivity in a rat uterine artery at physiologic pressure of 90 millimeters of mercury. Second is that e-cigarette aerosol exposure disrupts uterine artery vasodilation via the eNOS pathway. And finally, e-cigarette aerosol exposure decreases levels of excitatory post-translational modification and protein expression of eNOS in the rat maternal uterine artery. I'd like to thank the staff who trained me in performing all of these techniques and assisted me a little way too much with too much problem solving. And then most importantly, Professor Ramados, who was instrumental in making this project come to fruition as the principal investigator, but also as a mentor, instructor, and generously allowing me to use his lab. So I'd like to thank all of you